This is Repatha. It's a PCSK9 inhibitor, and it's one of the strongest cholesterol-lowering medications on the market. It can lower LDL cholesterol as much as 70%. So a majority of our cholesterol is made in our liver, and of course we can get some from the diet. In fact, we can get too much from the diet if we eat too many eggs, and dairy, and meat. And cholesterol is important. We need it to make our cell membranes, we need it to make bile salts to aid in digestion, and of course it is the precursor to a lot of the hormones that we make. Now, in order to get cholesterol out of the liver, we need a low-density lipoprotein, LDL, and LDL is actually made in the bloodstream, and it will then come to the liver, take out cholesterol, deliver it wherever it needs to go, like the adrenal glands, and then it gets returned to the liver, where it can be recycled, and we can repeat the process all over again. The problem is when there's too much LDL and cholesterol, whether that's from the liver synthesizing too much inappropriately or from us ingesting too much dietary cholesterol and fat, the recycling process of LDL becomes saturated. So the liver makes a protein called PCSK9, which is responsible for down-regulating LDL receptors. Because when there's too much LDL, we can't just continue to stuff the liver full of LDL. So PCSK9 needs to regulate this amount of LDL in the liver. Due to this lack of negative feedback in the liver, LDL continues to roam around in the bloodstream where it can potentially stick to blood vessel walls and stick to platelets, which can end up increasing the risk of atherosclerotic cardiovascular disease. But fortunately, we have Repatha, which is a monoclonal antibody that seeks out PCSK9 and inhibits it. So that way, PCSK9 doesn't downregulate LDL receptors, so we can continue to take in LDL and recycle it in the liver. And Repatha is a subcutaneous injection that can either be injected once every 2 weeks with the 140 milligram dose, or once monthly with the 420 milligram dose. And the great thing about Repatha is that it's not known to cause any liver problems, and it can be used alongside statins. And the common side effects with Repatha are some injection site reaction, some musculoskeletal pain, and sometimes some flu-like symptoms like stuffy nose and sore throat.